If you're preparing for your NMC mental health Osce, it is very important you learn how to do the talking therapy. Talking therapy is one of the procedures in the skill station of your mental health Osce. Remember, we have 6 skill stations, and for your mental health Osce, you only have to do 4 skill stations. And to make sure we understand more, I'll be using these criteria provided by the NMC just to make this video. Remember, this is a mental health scenario and you're dealing with a mental health patient. First thing you have to do once you come into your station is always to check for scene safety. So once you come in, assessor, I can confirm the environment is safe for I and my patient. Remember, as you're saying this, you have to look around. You just don't stand like a statue and tell your assessor the environment is safe for I and my patient. How did you know that the environment is safe for you and the patient? So what you have to do is to look around. Then you verbalize, assessor, I can confirm the environment is safe for I and my patient. For talking therapy, you do not need to provide any privacy. You don't need to. Remember that the talking therapy is just 8-minute session. For 8 minutes, you have to do everything you have to do under that 8 minutes, and limiting some procedures you do is still going to save you time. So once you've checked for scene safety, you do not need to do any hand hygiene for your talking therapy. You also don't need to put on a glove for your talking therapy. So when you come in, your assessor is still going to tell you this is your patient, this is the person that you would be practicing with. Once you come in after checking your scene safety, then you have to introduce yourself. Hello, I'm Nurse Jessica. I'm one of the mental health nurses. I am here to tell you about talking therapy. Is this a good time? So asking the patient, is this a good time, is also a form of taking consent. You don't have to tell the patient, oh, I am here to do talking therapy, this one and this one. Do you give me consent? No, you don't have to do that. Remember, you are battling with your time. Time is not your friend in your NMC Osce. So once you've introduced yourself, the patient is going to tell you, oh, all right, oh, welcome. Next thing here on the marking criteria is to check patient's ID by asking for name and date of birth. So you can now go ahead after the introduction and taking consent. You can now go ahead. Oh, okay. Before we start, can you tell me your name, your date of birth, and your hospital number? The patient can now say, oh, I am Harry Thomas, date of birth 1st of the 1st 1960, and my hospital number 1234556. You've done your introduction. You've gotten the patient's ID. You can now check. Oh, all right. I can confirm I have the right patient. You go on. Next step here is to gain consent and continue the visit. Remember, you've already taken consent during your introduction, so you don't have to take another consent here. So next step here is to discuss reason for referral and the patient health questionnaire. So you go on and open your patient health questionnaire. So you go on to tell the patient, oh, I have your PHQ-9 here. This is what the PHQ-9 looks like. This is what it looks like. I am going to attach the picture to this video. So you go on and tell the patient, oh, I have your PHQ-9 here, and from the total score of your PHQ-9, you scored the total score of 15 out of 27. Oh, and this gave you a provisional diagnosis of major depression, and the treatment recommendation is antidepressant and psychotherapy. Oh, Harry, can you tell me why you've been depressed? So now you're asking the patient to tell you why he is feeling depressed. So the patient will now go on and tell you, oh, I lost my sister, I've been feeling so sad, nothing interests me anymore, I just want to go home and sleep, I don't want to do anything. The next step on the talking therapy is to listen to and acknowledge the person's feeling using reflective language and validation. Show empathy, acknowledge person's feelings, compassion and kindness. So for this step, what you have to do is to listen attentively to the patient. You do not have to cut the patient short. So as the patient is telling you all these stories, you can just nod just to show that you're listening attentively to what the patient is saying. So once the patient is done, you can now say, oh, Harry, I know this has not been an easy time for you, and losing a loved one is something most people do not even know how to cope with. I am so sorry for your loss. But for this session, I'll be telling you about talking therapy and best way you can cope with this loss. Is that all right? The patient will tell you, oh yes, that's fine. You now go on to tell the patient the benefits of talking therapy. So if you look at the marking criteria, there are so many benefits of talking therapy. You don't have to mention all of them. You don't have to. Time is not your friend in your talking therapy. So you just have to pick like 2 or 3 points here. In my OSCE, what I just said was, all right, for this talking therapy is a time for you to shout if you want to shout. It is a time for you to talk to someone. You know, it is easier to talk to someone you do not know than talking to someone you know. This is also going to help you to feel free. You get, that was just what I said. I didn't go on to start listing out all these things. Save your time. So we are just going to read out the criteria as written here by the NMC. So having time to talk, cry, shout, or just think. Having someone to listen to how they feel can help. It can be easier talking to a stranger than to relatives or friends. Assist to find own answers to problem. You can still tell the patient, talking therapy is not going to solve your problem, but it is going to give you ways or solutions on how to solve it. Do you understand? So it is also here. It is an opportunity to look at problem in a different way with someone who will respect you and the opinion in a non-judgmental manner. Overall aim of talking therapy is to help the person to feel better. Talking therapies won't make the problem go away, but therapy may make it easier to cope with problems and they feel happier. So once you've done that, you can still go ahead and make sure that this patient is listening to you. So once you've explained the benefits of talking therapy, then you go on to tell the patient, do you understand? The patient will tell you, oh, yes. You now go on to say, all right, so I'll be telling you now the different types of talking therapy. We have the counseling, we have the cognitive behavioral therapy, we have the psychotherapy, we have the interpersonal therapy, we have the mindfulness-based therapies. All these criteria, remember they wrote here on the 8 marking criteria that identify and clearly explain the most relevant therapeutic intervention with the person. During my own OSCE, I explained everything here in the different types of talking therapy. But to save your time, you can just explain the one you think the patient will benefit from. Do you understand? So you can go on and say, oh, in counseling, you have to sit with a therapist. This, you can have 30 sessions with a therapist. In this form of therapy, it is a time for you to share how you're feeling with the therapist. Do you understand? Just cut it short. You don't have to say something long. Then next thing here is the cognitive behavioral therapy. This would highly benefit any individual that is battling with any behavior that they want to stop. If you know someone that has an addiction that wants to stop the addiction, this CBT is going to benefit the person. Then you go on with psychotherapy, go on to explain interpersonal therapy, go on to explain mindfulness-based therapy. Then once you're done explaining this, you now tell the patient, looking at what you've told me and considering the situation you're in at this moment, I would greatly recommend that you go for counseling. Remember, this patient has told you that they lost a loved one, and you have to know, oh, someone that has lost someone, what is this person going to benefit from? It's definitely counseling. Do you get? So you tell the patient, oh, okay, since you've lost your loved one, you would benefit greatly from counseling. So if this patient has told you that they smoke a lot and they want to stop smoking, you don't have to go on to tell the patient to do counseling. Even if you tell the patient to do counseling, also chip in CBT, cognitive behavioral therapy, because this is meant for people that are battling with any addiction or they have any habits they want to stop. You can recommend the CBT. So it is from what the patient tells you, you would know the talking therapy to recommend for this person. Do you understand? So next step here is recommend a specific therapy, giving rationale for choice. We've already done that. So if you're telling this patient you're going to do counseling, tell the patient why you want them to go for the counseling. You're going, because you're depressed and you're battling with the loss of your loved one, this counseling is going to benefit you. Then if it is mindfulness-based therapy, oh, you have a childhood trauma, you want to forget this, you want to forget that, you tell the person, okay, you can go for mindfulness based therapy. Then the next point here is to recap area discussed prior to ending your visit. So now you're done recommending the talking therapy you want the patient to go for, and you've asked the patient, do you understand, is this something you can do? The patient will tell you yes. Okay, if it helps, I am going to do that. Then you now say, okay, I am just going to recap what we've just done. When I came in here, I greeted you, we had an introduction. I also went on to check your PHQ-9, which I told you the total score on your PHQ-9. You told me you've lost your loved one and you're not feeling happy about that. I went on to tell you the benefits of talking therapy. I also went on to recommend a talking therapy session for you, which is counseling, and you agreed to do that. Is that correct? The patient will tell you, yes, that's correct. And that is it. you ask the patient, oh, do you have any question? Do you want to, do you have any worries? Do you have any question you would want me to answer to? Patient will tell you, oh no, nothing, everything is fine. You know, it's all right. Thank you so much for having this session with me, and please do not forget to ring the call bell, you know, just to add little toppings to your exam. Oh, don't forget to ring the call bell if you need any help, or you dial 111 for any assistance. Okay. That is it. Your talking therapy session is over. So I am still going to make a proper detailed video, and I just don't know who to use as a patient, just to explain how the talking therapy session works. So during my own OSCE for my talking therapy, I forgot, you know, exam can come with tension. So I forgot to mention the benefits of talking therapy. When I now remembered was when my time was just 1 minute, I verbalized it. Oh, all right. Oh, I forgot to you tell the patient, oh, I forgot to tell you the benefits of talking therapy. You know, in this talking therapy, it is a time for you to shout if you want to shout, cry. You know, I like that sentence. So when it comes to cry, if you want to cry, shout if you want to shout, it is not going to take your problem away, but it's just going to show you ways on how to solve it. You know, so once you familiarize yourself with all these stations, passing the NMC mental health OSCE would not be difficult for you. So which other stations would you want me to explain on? Drop it on the comment section, and I am going to make a video on that. See you next time. Okay, bye.